Today is January 12th, 2024. 1 year ago today, Lisa Marie Presley passed away in West Hills, California. And I thought that I would interpret or read her autopsy report for you and interpret as best I can. I did a lot of research on this, and I hope I'm going to make sense of this for you, because it took me a long time to make sense of it for myself. So it says the name, first, last, middle name, Lisa Marie Bolu Presley, which is, Bolu is Priscilla Presley's maiden name. So it's just interesting that she would have that name on her death certificate. But Lisa Marie Bolu Presley, normal address, 5925 Normandy Drive in Calabasas, California. And she passed away at the West Hills Hospital and Medical Center on Medical Center Drive in West Hills, California. The autopsy report, this is the verbalization of the case done by a sergeant, homicide sergeant, Detective Takashima, and it takes place at the West Hills Hospital Medical Center. And the daughter was notified. That would probably be Riley Keough, Lisa Marie's oldest daughter. Lisa Marie was last seen 2 days before this at the Golden Globe Awards when the movie about her father, Elvis, was being shown at the Golden Globes. And most people commented when they saw her, they were sort of surprised at her appearance, because she did not look healthy during that, and she wouldn't last probably a little over 48 hours at that point is when she'd be gone. Now it says, according to investigators' case assignment form, on January 12, 2023 at 5:31 from West Hills Medical Center reported an apparent accident versus natural death of Lisa Marie Presley to investigator Ryan Benavidez Perez. It was reported that the decedent, from now on, if you hear me say decedent, we're talking about Lisa Marie. She had a history of depression, anxiety, CVA, which is a cerebral vascular accident, and substance abuse. And it has in parenthesis a subtext, that drug that came up in Matthew Perry's autopsy not that long ago. She was found unresponsive at home in cardiac arrest. A return of spontaneous circulation was achieved, and her stomach was severely distended. An x-ray showed ischemia, ileus, which is I've written this down. It describes a variety of conditions that occur when blood flow to your intestines decreases. Ischemia can be due to fully or partially blocked blood vessel, usually an artery, or low blood pressure leading to an overall reduced blood flow. Intestinal ischemia can affect your small intestine, your large intestine, that would be your colon, or both. And ileus also is the lack of movement in the intestines, providing blockage of food. So the stuff that goes in is supposed to come out the other end, but it didn't. It was blocked. And she went back into cardiac arrest, and death was pronounced. The toxicology was positive for acetaminophen, which is like a Tylenol, like a painkiller of some sort. The detective homicide sergeant says, I was assigned this case at 9:15 on the 13th, the next morning. Forensic attendant Gus Valdivia transported the decedent from the hospital to the medical examiner at 10:10 a.m. the next day. The location, again, the West Hills Hospital Center. There was no, it said under injury, they have to report any injuries. This is unknown. Reported history of over-medicating. On the morning of January 12, 2023, the decedent was not feeling well and had complaints of abdominal pain. Her ex-husband then took her children to school, and when he returned, he found her unresponsive. He called 911 and began CPR.
LA County Fire Operator 55, what's the address of the emergency?
We don't know what this is.
How about?
It's...
Yes, but the closest street on the corner is
I don't know. What is it here? I really don't know. It's in that...
Okay, ma'am, I'm sure this is in Is that correct?
No, it's just offload
Ma'am?
oxygen.
Is there someone else there with you right now?
Yes, he's
453.
he's trying to.
Okay, can you hand him the phone? Because I can hear him a little bit better than I can hear you.
Hi, hello. Hi.
Okay, sir. Listen, paramedics are already on the way. Code that they need to get in there?
No, there's a security gate on the neighborhood, but they'll just let them through.
Okay, Ken. Okay, just want to make sure I have the right location.
How far are they?
I have no idea where they're at right now. So over.
I think they're here.
Okay, are they there with you?
Okay. Go ahead and
Okay.
hang up with you guys.
All right, thank you. All right, bye.
She was transported to the hospital where death was later pronounced. Per the initial deputies at the scene, no obvious paraphernalia or narcotics were found. She had no reported recent injuries or accidents. She had no known medical history. She reportedly had a history of unspecified drug use in the past and had been sober for the past few years. Foul play is not suspected. On the 12th, she was found unresponsive by her ex-husband at approximately 10 to 15 minutes of downtime. The ex-husband called 911. I know this is repetitive, but I'm reading the document. Paramedics arrived at the scene in approximately 10 minutes and were able to achieve the return of spontaneous circulation. She was transported to the hospital via ambulance and arrived at 11:21 a.m. She was seen to have a severely distended abdomen, which was rigid. While in the emergency room, the decedent went into VFib arrest at 12:28 and again at 1:01 p.m. After a return of spontaneous circulation was achieved, a temporary pacemaker was inserted at 1:15 p.m. She was then admitted to the ICU for further management. A head CT showed evidence of severe anoxic brain injury. Now that is the loss of oxygen, and they always say, if you lose oxygen, if you stop breathing, you'll get brain damage. It usually takes a few minutes. They say around 4 minutes for that to happen. But after 4 minutes of no oxygen to the brain, it starts breaking down, thus brain damage. A CT of the chest, abdomen, and pelvis showed a very distended abdomen, concerning for ileus, which is, again, that lack of movement of the waste going through, which should be going out the other end and just wasn't. A urine toxicology screen was negative. The decedent was also found to have severe metabolic acidosis, that's way too much acid in her system. Her condition continued to decline, and she went into cardiac arrest at 4:48 p.m. Despite all resuscitative measures, she was pronounced dead on January 12, 2023 at 5:08 p.m. And this is, again, the detective writing this down. Via telephone, I spoke with the daughter, and she provided the following information. The decedent, Lisa Marie, had a history of issues with her blood sugar and blood pressure. She was taking medications for her blood pressure. The decedent had cosmetic surgery a few months prior and was prescribed opiates after. She later developed an infection and was admitted to the hospital. She was again prescribed opiates. She was then later prescribed a new medication so she could be taken off the opiates. The decedent had a history of over-medicating. She was known to forget that she had taken her medications and would take them again. The decedent had a history of alcohol abuse and illicit drug use in the past. She had reportedly been clean from both since 2015. She smoked a pack of cigarettes a day. She had experienced issues with constipation for years. She also had a distended abdomen for years. The decedent had complained of abdominal pain for the past few months. She did not seek medical attention. She also had complaints of feeling feverish and vomiting and or feeling nauseated for months. On the morning of January 12, 2023, she had complaints of severe abdominal pain. The family has no suspicion of this being a suicide. The scene description: death had occurred at a hospital, therefore no coroner scene investigation occurred. So if they were at home, if she died at home, you would naturally look around the room to see if something happened, pill bottles or weapons or whatever. Since it was in the hospital, they didn't have to do that. The body examination. She is an adult Caucasian female who was viewed on a table at the Forensic Science Center. She was nude. Multiple medical appliances were seen in place, including an endotracheal tube, EKG patches. There was an IV on the top of her right hand, central line, right femoral line, urinary catheter. Bandages were seen on her left antecubital fossa. That would be her elbow, basically, probably an injection, and right middle finger. Apparent superficial wounds were seen to her chest and back. Purplish discoloration was noted to the right, the elbow would be the right elbow. Her abdomen was distended. She was noted to be incontinent of her bowels. Apparent healed scars were observed to her breasts. A tattoo of an unknown design were seen to her right inner wrist. And the words Ben, twice, her son's name, Ben, 2 times in a row, was tattooed on her left hand. There were no obvious signs of trauma seen. Ben, her son, who ended his life a couple of years before this. She was visually identified using her Cal photo image as Lisa Marie Bolu Presley. Family also viewed her at the hospital and confirmed her identification. Unknown tissue donation. Now, this is interesting. Probably the first thing that was filled out by someone at the hospital was this form, because it was handwritten. And in this one, it says the patient was unresponsive, no sedation, pupils fixed and dilated, no reflex present. In my opinion, the cause of death is severe metabolic acidosis. Again, back to the acid in her stomach. That was the original document that was handwritten. So again, this is the summary of events. It's repetitive, but this is the document. I've got lots of notes on this so I can hopefully explain it. The decedent, Lisa Marie Presley, is a 54-year-old Caucasian female who was complaining of abdominal pain in the morning of January 12, 2023. She was later found unresponsive at home and 911 was called. She was transported to West Hills Hospital, where, despite medical intervention, she was pronounced dead at 5:08 p.m. During her hospitalization, she was found to have a severely distended abdomen and diagnosed with severe metabolic acidosis, which is too much acid in her system. The external examination. The body is identified by toe tags as that of an unembalmed, refrigerated adult female Caucasian who appears about the reported age of 54 years. The body weighs 139 pounds and measures 62 inches, which is just under 5'2". She is well-built, muscular, and well-nourished. Numerous well-healed scars are noted to the mid-abdomen above the umbilicus, which is the navel, as well as to the right and upper left quadrants and lower quadrants of the abdomen. A well-healed scar is noted above the right eyebrow. Small, well-healed scars are noted on both the right and left forehead at the hairline. However, there are 4 separate 0.5 centimeter rectangular punctures on each side of the frontal parietal bone above the temple that involve only the superficial table of the skull. A scar is noted to the upper of the left forearm. Well-healed scars are noted to the right and left breasts. Multiple tattoos are identified. A symbol is noted to the back right forearm. Another symbol is noted to the left under the forearm. The word Ben twice is noted on her left hand. There's a tattoo of a design on the front of the right foot. Now, that design is like a Celtic circle that both she and her son got identical tattoos on the right foot, on the top of the right foot. And also she had the astrological signs of her children tattooed on her body. And one of them was the Libra. Ben was the Libra And there was also an omega tattoo, which is the end of something. It's the end of the Greek alphabet, but it's also the end of, life, probably in this case. And maybe she had that tattooed after Ben died. I'm not quite sure, but nobody will really know. Her family might. The head is normocephalic and covered by long, wavy brown hair. Examination of the eye reveals irises that appear to be hazel in color and the sclera that are clear. That's the whites of her eyes. There are no petechial hemorrhages of the conjunctivae of lids or the whites. So there aren't any broken blood vessels in her eyes, which would happen with, strangulation or something. That's just a typical thing they look at when they're doing an autopsy. There were no broken blood vessels in her, on the whites of her eyes. Upper and lower teeth are present. The neck is unremarkable. There is no chest deformity. There is no increased anterior-posterior diameter. The abdomen is distended and firm. Signs of cardiopulmonary resuscitation are as follows. Defibrillator imprint noted to the left back. Red abrasion is noted to the anterior chest. That's the front. A rib fracture is noted to the front lateral right third rib. There is evidence of old surgery scars present on the abdomen. The gallbladder, the appendix, and both ovaries are gone. Now, I looked up that, and the removal of your ovaries is what's called an oophorectomy. And it's mostly because the most common reason would be an ovarian cyst for having that procedure. It's also used to treat problems such as a twisted ovary and to remove the risk of developing ovarian cancer. The body wasn't clothed at the time of autopsy. No clothing accompanied her. The incision was a standard Y incision, so they could access the organs. Now, there's respiratory system, there's neck, and there's, it's all very normal and very, very technical. And these are all things that they have to go over. The gastrointestinal system. The esophagus is intact throughout. The stomach appears tubular in shape with surgical staples noted to the left lateral aspect of the stomach. So this is interesting to note because that means that she had probably bariatric surgery, which is stomach stapling, and by the appearance of the staples, surgical staples. So in that case, bariatric surgery procedures include gastric bypass, sleeve gastrectomy, and gastric band, and stomach stapling. These are all surgical procedures to lose weight. It effectively treats morbid obesity in people for whom such as diet, exercise, and medication have not been effective. They also help to normalize your metabolism, including blood sugar, blood pressure, and cholesterol. Gastric stapling surgery, also called gastric banding surgery, is a type of bariatric surgery for weight loss performed to limit the amount of food a person can eat. After gastric stapling or banding, a person can eat only about 3/4 to 1 cup of food, and the food must be well chewed. Eating more than the stomach pouch can hold may result in nausea or vomiting. So that happened. So she did have that surgery earlier on. I don't know what year that was. It does say no tablets or capsules are identified in the stomach. The toxicology. They did remove blood tissue, blood, liver tissue, and vitreous humor, which is the gel in your eyeball. They take a needle and extract some of that liquid, the gel that's inside your eyeball, so they can examine it and submit it for toxicology. And it says photographs have been taken prior to and during the course of the autopsy. The opinion of the LA County coroner. The cause of death of this 54-year-old female identified as Lisa Marie Presley is sequelae of the small bowel obstruction. That's a condition, is a consequence of a previous injury, meaning surgery, the surgery that she had, the bariatric surgery. The obstruction was in the form of a strangulated small bowel caused by adhesions that developed after bariatric surgery years ago. So that cuts off the blood supply to the intestine. This is known as a long-term complication of this type of surgery. Review of the toxicology results show therapeutic levels of oxycodone in the blood. Quetiapine as an antidepressant. It's also used to treat an opioid disorder. Along with buprenorphine, with associated metabolites, are also present and not contributory to death. There is no evidence of injury or foul play. The manner of death is deemed natural. And this is a chart which I will also put into the to the video, and you can just see the amount of injuries that she had, or life-saving measures, or tattoos, or everything. You could see, you know, the scars I mentioned that were on her skull are here, and you could see. So I don't know exactly what that was. I'm guessing I would be. Well, anyway, speculation. The rectangular punctures on the skull. I don't know what that would be. I'm guessing cosmetic. That's my guess, and I don't think that's a wrong guess. But her toenails were painted green. The tattoo on her right, the top of her right foot, and her wristband and a toe tag. Yeah, so she had a lot of drugs in her system, but the finalized report, which I have here, is a ischemic bowel, artery supplying the bowel, reduced the blood flow, incarceration of the distal small bowel, adhesion of small bowel to peritoneum posterior right lower quadrant of the abdomen, remote bariatric surgery, severe metabolic acidosis. And also noted the fracture of the right rib during CPR, and the drugs present. The antipsychotics, which is the quetiapine metabolite, the buprenorphine, and the oxycodone. So oxycodone, buprenorphine counteracts. Poor thing. So that's Lisa Marie Presley's report, and accidental / natural death, January 12th, 2023. 1 year ago today. So that's that. Very sad, and a fascinating lady. Absolutely fascinating. So thank you for bearing with me. Thank you very much for your time and for your attention. Stay well, and until next time.
You heard me.